Welcome to the Flourish with Neural Retraining podcast. I'm your host, Madeline Lowry, founder of Twin Cities Neural Retraining and a certified MAP method practitioner specializing in anxiety, sensitivities, and chronic symptoms and conditions. Join me for episode 70, where my client, Dr. Alia Paquette, joins me again to ask even more questions about the MAP method and how it works. Having had 20 or more MAP sessions herself over the last 2 years, she is well acquainted with the method. To hear her story about how MAP sessions have helped her through traumatic times, including a bout of pancreatic cancer, please listen to my conversation with her in episode 67. As always, we must disclaim that the information we share in the podcast is for educational purposes only. As MAP method practitioners, we do not diagnose or treat disease. Instead, we work with the mind to optimize health. Now, let's talk with Alia. So welcome, Alia. Thank you for joining me again. I know you have a lot more burning questions to ask about the MAP method, and so here we are to give you an opportunity to ask even more questions about how the MAP method works. Welcome.
Thank you. I'm super excited.
Yeah. So following up on our first conversation, I think you managed to squeeze in maybe 4 questions into that hour.
Yeah.
Yeah. So we have more time to endeavor to answer your burning questions about the MAP method and how this all works.
Amazing. So one of the things I was thinking about based on the last conversation we had, where you were explaining that utilization of muscle checking throughout the process of an encounter with the patient in order to kind of guide the session and guide where you go in the session, was to kind of come back to that idea around muscle checking. I have very limited understanding and utilization of this idea of muscle checking or muscle testing. It's certainly not something that's used in Western medicine. And where I ran into it was with a few patients. I had a handful of patients who would utilize it in order to decide whether or not they were going to use a medicine. They would muscle test to see whether the medicine was appropriate for them. And then we'd have a discussion if the response was no. So the way I've seen it used is in response to a yes or no question. And then a little bit of muscle checking or muscle testing I've done in my personal life has been with a yes or no question. And sometimes I find myself trying to phrase something that's really complex in a way that the answer could be yes or no. So I was wondering, with your patients, sometimes it feels like you're asking a question that's more complex than yes or no, where the answer really isn't yes or no. And yet you still come back with an answer that seems more specific. So for instance, when you are looking at suggesting an age that something may have happened, that's happened in our sessions before, where you'll say, I'm getting a sense that something occurred between the age of 5 and 6. So that's not a yes or no question the way it's presented, right? But I could see how you could kind of twist that around. Is there a different approach that you use for more complex questions? Is there a different feedback you're looking for? Or is it, trying to phrase something more complex in a yes or no in order to keep using the muscle checking?
Maybe I can go over just a couple of things, right? So you talked about muscle testing and muscle checking, and I want to just separate, I want to define.
Oh, great. Okay.
So muscle testing is a technique that most people are familiar with. They go to see, say, a functional medicine provider who's trained in this, and the functional medicine provider is trying to discover what the root causes are, right? And so they are testing the strength of, say, your arm by applying pressure and speaking some different options, right? And trying to see where the muscles go weak. This is why it's called muscle
Okay.
test. In fact, it is not about the muscles. It is about your nervous system. So when you think about your nervous system is an electrical system. And when we talked about that field of information, we were talking about the quantum field. You talked about, like, you called it the matrix, or what I was talking about, the field, Lynn McTaggart's book, The Field. This field of information that pervades everything and connects everything, making it possible for you and I to work together in a MAP session over Zoom, even though we don't occupy the same space. So muscle testing is really a testing of the nervous system. I see it as kind of like picking up on some kind of impulse from this field of energy and information that helps us to understand what is true versus false for us. So when something is true, we have strength in the arm that's being tested. And when it is false for us, the arm goes weak. This is the premise of muscle testing. Muscle checking is a little bit different. Instead of accepting the default responses, we basically change what it is that we want to receive, because as practitioners, we are muscle checking through lists of things. When we are working in a session, we are working through this protocol and going down different branches of this tree. Different branches have different options for us. And this is what guides me and what instructions I am offering you when we are focusing on a particular subject. In order to make it efficient for us to move down a list of different options, we change the default so that it is strength, strength, strength for no, and weakness for yes.
Oh, okay.
And it is much easier to check a long list of things by going down the list and having the response be yes or open when we get to the thing that we want. So that's just a convenience, basically, that the MAP method has adopted, because it just makes it more efficient for someone who's working through many lists. When you ask, when I muscle check for a complex question, do I have a different approach? I really don't. It is all about yeses and nos. You can think about like the zeros and the ones that are behind all computer software, right? All computer instructions, all programming,
all of that language
boiled down to a sequence of zeros and ones, right? That turn on and off circuits on a circuit board and blah, 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 right? So it's kind of the same thing that we are drawing upon, except, I just need my fingers. I'm using my fingers. Sometimes it can feel like I'm getting an answer to more than a yes or no question, but really what I'm doing is maybe checking down a list on a protocol that I have. Like I'm being sent down this branch of my tree, my decision tree or whatever, my option tree, and it's saying, look for an original event. And so I'm getting that answer.
Okay. Yeah.
And then you may be talking about what you just experienced in that last round, but I am asking myself, and these questions don't have to be out loud. Like you aren't
right.
And you aren't hearing everything that I'm asking, right? Because I'm doing it at the same time. For a client, I think a MAP session can feel kind of easy and simple. There isn't a lot required of you. But for the practitioner, there's a lot more going on, right? There's multiple layers. I'm listening to you. I'm sensing. I'm asking questions, and considering all these different levels of information, I'm figuring out where we need to go, right? What's the next thing here? What's the important thing here? What's the dominant thread that needs to be followed? And so I think that's where it can feel like, oh, where did that even come from? What or why did she give me that set of instructions this time? She started talking about this, and like, why did she go there? And it's because I have lists and lists and lists and lists, and I am being guided to certain issues or concerns. When I get, oh, there's an original event behind this pattern, right? There is something that happened that sort of planted the seed of this pattern in your subconscious. Then I ask myself, oh, okay, was it in childhood? Yes. Okay. And so then I start counting 0 to 5 years old, 5 to 10 years old, and when I get yes, or 10 to 15, I keep going. And when I get yes to a category, then I start counting 10, 11, 12, right? So that gives me a number.
Yeah, that's very specific.
That's how I can, and it's not like I always tell people, it's kind of a fuzzy number, right? I might say 12, but it might be 11 and a half to 12 and a half. Often just putting out the age is enough for a client to kind of have a memory flash through their mind.
Yes.
And sometimes it doesn't, right? And that's okay. Either way is okay. I think it's an opportunity for you to connect some dots for yourself, but it is not always necessary. And sometimes when, the person's like, I just don't know, I'll say, fine, just focus on what you remember your life being like when you were 12, what you looked like when you were 12, what was going on for you when you were 12. And let's just have your subconscious clear it, because it has found something clearly.
That is so interesting, because you're exactly right, that from the patient or the client's perspective, I mean, that is the thing. That's the thing about our relationship that makes me say things like, I feel like I'm in the Matrix. Because it does. It feels very like you're part of a simulation, and like someone else is able to see things about your brain that you yourself aren't seeing. Which of course isn't what's happening. And honestly, that's not unlike any practice where you are the person educated in the topic and you are assisting or helping somebody who is not educated. I mean, of course, whoever's on the receiving end of a treatment, it can feel otherworldly. It can feel like magic. It can feel like it comes out of nowhere. When really there's just a wealth of knowledge in the practitioner's banks that they're able to utilize. So yeah, that's really interesting. And I wondered that just in the little bit of muscle checking that I have done for myself in the last year, that's exactly what I find myself doing without training. I find myself, trying to take a complex issue and break it down into the zeros and ones in order to get answers that I can then follow to a more complex answer. So yeah, that's fascinating. That's really, really interesting. and I have people I'm going to tell about this who have seen you and are like, how does she do this?
Yeah. So yeah, I mean, the other thing I want to say about muscle testing is it's not all about the muscle testing. I take the muscle testing as guidance. I don't take it as like definitive truth.
Yes.
We can ask a question and get a certain answer on one day. That answer could change the next day. Also, I have found that if I'm trying to decide between 3 different options, I may get one. I may get one option as the preferred option, but then if I add in a 4th option and retest, I could get a different answer. So it really also depends on the subset of possible answers that you are considering. What I'm getting with the muscle testing or the muscle checking, I have to also factor into everything I know from practice, everything that you were telling me, and then other things that I'm picking up. So I've been doing this, I would never have said I was an intuitive person, right? I think I probably came into this whole thing with maybe like a little crumb of intuition, and I've been leaning heavily on it to do what I do. And so that crumb is like getting bigger, I think. But I've been doing it long enough that sometimes, I'm getting information in other ways as well. Sometimes words just come into my mind, or sometimes I pick up even physical symptoms from the person I'm working with. Their heart starts to beat faster and my heart starts to beat faster. I also sense the processing that's going on for the other person. when we're in a session, it's kind of like a bridge is being formed between your subconscious mind and my subconscious mind. And I sense what is happening for you on some level. For me, it's like REM eye movements.
Yeah.
Sometimes I'll give an instruction and I feel like a storm of activity going on. And I think, oh, okay, that we hit something. Sometimes I'll give an instruction and it's just very lackadaisical. And I think, okay, keep searching, right? We haven't quite hit it yet. So there is multiple streams that I'm considering.
Yeah.
Mm-hmm.
Yeah. And I can see how then the muscle checking could be used just to kind of help in the process of that integration. Like how do we sort through some of this information in a quick way, like you were saying, using it to kind of rapidly sort, but not as the finite decision maker of what's going on in the moment. Which, yeah, that's really, really interesting. So that kind of leads into another question that I have, which is in one of the things you're taught in medical school is about protection of self. Ironically, because the industry itself does not protect you, but it's about protecting yourself from taking home a patient's feelings, right? So carrying the burden of a patient's feelings or a patient's diagnosis, not to, I don't think to block out empathy, but more to make sure, because if this is your job and this is what you're doing every day, if you are seeing and hearing things that are very, very difficult to see and hear, and you carry all of that with you all the time, obviously that can have a detrimental effect on your psyche and your ability to kind of leave work at work and be present in your personal life. So, there's a lot of that discussion through medical school about protecting yourself and making sure you don't do this. They never really tell you how to do that, though. They don't really tell you how to leave it at the door. So that's also interesting. They just warn you that you should be, protecting yourself from this phenomenon. How have you done that in your practice? I mean, on the one hand, I could see how maybe your insight into this connectedness between all living things would almost make it easier to separate, right? To say, okay, I don't have to carry this around, because if I'm you and you're me and, I'm the ocean and I'm the trees and this is all happening at once, I don't need to focus on any one thing. It's okay. On the other hand, I imagine that on a regular basis, you're hearing stories that are very, very difficult to hear, that you are gaining insight into some of the most intimate and personal kinds of trauma that people can go through. And even when it's something simple, like, again, you and I, when I say simple, I just mean common, like you and I discussing in our last session the death of my dog. That happens all the time. And yet I'm sure you can feel the emotional charge that's behind that death for me, that loss. So like, even a story like that over and over and over again could, I imagine, be hard to just, kind of set down. So are there specific techniques you use to protect yourself, or do you find it's not even necessary? Do you find you're able to kind of check it at the door?
Yeah, I think it's a professional hazard.
Yeah. Yeah.
Because, you may have noticed this, but like when we're in a session together, it's almost like the boundary between you and me feels very fluid. And in fact, you will hear me get confused in my pronouns.
Yeah.
Right? I start talking about ourselves and
yes.
us instead of you and me.
Yes, I do notice that. Yes, very much. Like what we did, what could we have done differently? And it's funny because as a patient, I love it. It makes me feel like, yes, I'm not alone. What could we have done differently? But I don't know that that's intentional.
It's not intentional. I'm not choosing those words intentionally. That is how it feels to me.
Yeah.
That the you and me have melded into us, and that's just how it's feeling to me, right? That's how it's coming out in my language too. So yes, so to be a MAP practitioner, you have to be open to the other person, right? And and I deal with very traumatized clients because there is a connection between trauma and chronic health issues. And because of what I specialize in, chronic health issues, that means that I'm seeing a subset of sometimes extremely traumatized people. That is something that I am opening myself up to every day in working with clients. And I do think that, depending on the personality of the MAP practitioner, I do think that the ones that are more empathic, it can make them a better practitioner because it's easier for them to do that melding thing. But it can also open them up too much to taking in other people's trauma patterns. So there is self-care that MAP practitioners do. We can do MAP on ourselves, and we can manage, I guess, the load or what we take on that way. Also, I think just doing it, for a number of years, you learn, I don't know, it just becomes a little bit easier to be in that melded state in the session, but then to let it go afterwards.
Yeah. I mean, I found that to be true in my practice in a different way, that there were some cases and some situations where it hung with you longer, even if you were, more practiced at leaving it at the door. But it got easier as time went on to create that space and those kind of boundaries. So I can understand that tracks. And that actually led to another one of my questions, which is can you perform MAP on yourself? And that feels, so for anyone who's done MAP, that could feel like a little bit of a loaded question, because a lot of what you provide us with, right, are MAP resources that we can do on our own. So when I ask that, I don't mean, you can listen to the audio support and you can do, because anyone can do that. What I mean specifically is like a MAP session. Is there something that you would do that is that formal, that formalized to yourself and specific to yourself? Or is it better to go elsewhere and have your own MAP practitioner? That's again, the idea in Western medicine is we should never be your own diagnostician. You need to get someone else to do it. But this is such a lovely insight into the way the brain works and the connectivity of the brain and the body. I would imagine it would be really useful to use on yourself if you could.
Yeah. So as MAP practitioners, we can do self sessions. I rarely do, just because I don't have that many identified issues, and I don't have the time. Doing a lot of MAP sessions each day, and the thought of sitting down again and doing it myself after hours is daunting. But yes, we can do them on ourselves. And in fact, as you were going through the certification program for MAP practitioners, you are getting a lot of sessions yourself. Through group sessions that are offered and through practice sessions that students are doing on each other, trading sessions. And this is important. What I want people to understand is the value of a MAP practitioner is not just that they are schooled in this protocol, the MAP method. It is not just that they are trained in how to connect with their subconscious mind to your subconscious mind. The other, aspect of the value of a MAP practitioner is that they have gone through enough of these sessions that they have cleared a lot of their own stuff. And that makes them a clearer channel, so to speak.
Yeah.
For you.
Yeah, that makes sense.
In the beginning, when you were training in the early years of working as a MAP practitioner, you are doing a lot of MAP, and MAP from different sources. But even as a practiced MAP practitioner, I do think, so the fourth value I would say of working with a MAP practitioner is that the MAP practitioner, especially when they're focused on a niche, they have a certain type of clientele or a certain practice issue that they work with a lot, right? They are able to help you to see your patterns in a way that's hard to do yourself.
Yeah.
And so I think that is another value. And I have been asked by very experienced, sometimes even more experienced than me, MAP practitioners, to do sessions for them. So we do sessions for each other. I think that it can be very helpful to have someone, outside of your head, right?
Yeah. Yeah.
Yeah, connecting with you, helping you to see what the issues are, and taking you through the process.
Interesting. So with kind of deciding how to then utilize those therapies for self, when you are going to consider using them for self-care, have you found in your life that is it something you turn to when there's been kind of a bigger trauma in your personal life, or a bigger maybe downloading of trauma from other people, where it's like it kind of starts to build and you need someone to reset, like a cleansing of the palate, so to speak? Or is it really more for a more focused event, for your personal experience? Have you utilized it in that way?
I mean, it could be for anything, right? It can be
Yeah.
just like any MAP session. When when you come to see me, we can work on a particular event that was traumatizing, right? We can work with a particular thought, like a repetitive negative thought or belief that is limiting you. We can work on a physical symptom. We can work on a pattern, and we can also work on a goal. Like, I have this goal and somehow I am not getting there, right? I have these self-defeating behaviors, or something is getting in my way. It's the same,
it's the same idea. You haven't turned to it in your personal life for one particular thing. It's been, whenever you notice, like, hey, it's time. I need.
I'm getting triggered, or triggered by something is probably the most common.
That makes sense. In the process, so in medical school, and I'm an osteopathic school, so being an osteopath, we do a lot of we learn the practice of osteopathic medical manipulation, or OMM or OMT, where you're doing physical adjustment to help optimize body function. And we do a lot of the same thing, right? Where we're each other's guinea pigs. You walk into this big lab and you're paired up with groups of people you've never met before, but you quickly kind of break, most of us at least, you kind of quickly break down barriers, and it's just so educational that it becomes really beneficial really quickly. Do you find, or in your experience when you were training, was that difficult for people, either for you or for other practitioners, to again start letting a bunch of strangers kind of dig around in your most significant traumas or histories, or thoughts, or was it quick? Was it easy to break down those barriers and let someone in because it's so interesting?
I think it was easy.
You're kind of all there for the same reason.
And MAP is a pretty easy and gentle process to work with, right? I mean, no one is touching you, and no one is in your space, and you decide what it is, you bring to the session, what it is you want to work with, and then you focus on what the practitioner tells you to focus on, and you just wait to see what shows
with it,
right? I mean, right? You just flow with it. So nothing particularly hard that you have to do, except of course if there is a painful emotional memory, a really traumatic one, right? That can be painful, but because when you're in the certification program, you already know that, yes, it's going to be painful for me to look at this memory, but in a few minutes, my subconscious mind is going to be neutralizing the painful emotions. And this may be the last time that I feel
Yeah.
this intensity of pain about this trauma memory. So it's worth it,
Yeah.
Yeah.
Yes. I could see how dangling that carrot would make it a lot easier to to just move forward. And that is a really nice thing about MAP too. I mean, again, for people who may not have experienced it before, the fact that you get to choose how how much you want to verbalize about the experience that you've had, which obviously is true in any kind of therapy. But the difference here is that, unlike talk therapy, if you don't figure out a way to put into words what it is you went through, you're probably not going to get anywhere. Whereas with MAP, you don't have to say too much about it. Even just remembering or taking yourself back there is enough. So that would allow you to, again, maintain some of the whatever level of comfort you're having around sharing a story. You get to maintain that and still have optimum benefit.
Yeah.
Yeah, but I can see how going into OMT and letting people, a bunch of strangers, adjust our bodies was probably harder than letting down the barriers for MAP therapy. Because yeah, you're right. The neutralization is so quick and nobody's up in your space and you have more control and more say over what's happening. So
Yeah.
I can see how that would be, yeah,
Yeah.
helpful.
And like you said, it can be very private, right?
Yeah.
Someone
Yeah.
who just really doesn't want to talk about it. I just need a few words. I just need to
Yeah.
know,
Just something to go on.
yeah, how old were you? Can you tell me in one sentence, or one phrase, like what it is you are focusing on? And as long as you know what the memory is and you can bring it up and you can feel the emotion around it, that's all. And you just tell me what the emotions are. I feel sad. I feel degraded. I feel whatever it is. And you give me a sense of the intensity, then we have what we need to work on it.
Yeah.
You
Yeah.
know?
That's incredible.
Yeah.
I think that's one of the most amazing things about MAP is
Yeah.
to be able to concentrate, 5 years of talk therapy into a 1 hour session is just remarkable.
Yeah. And so maybe a point that we haven't made so far is that with the MAP method, there is an initiation that happens in the beginning. The practitioner, of course, is initiated to the method, but the client also has to be initiated. This is what we do in the introductory session, right? You watch a 15-minute preparatory video that talks about memories and how they form the personality. And then you come into an introductory session where the first 10 minutes or so are focused on kind of setting things up, a few preparatory instructions so that your subconscious mind and my subconscious mind can work well together. So we really have two practitioners in the room, every time we do a MAP session, because while I am sensing and guiding and giving instructions, it is your subconscious mind that is actually doing
running the
lifting,
session. Yeah.
right?
Mm-hmm.
It's
Yeah.
your subconscious mind that's rewiring itself. And so that, that is another aspect of the MAP method, I think, is it makes it more powerful, and it also makes it more, I don't know, personal, right? This is why you don't have to tell me everything. As long as you have it yourself, it is your own subconscious mind looking at its own set of memories and healing. Yeah.
That's really empowering. And I mean, I think takes away a lot of the anxiety or the fear that people could have around pursuing something like any kind of therapy, but something specifically like MAP therapy. Because you hear that often when you're trying to help people, especially through these kind of big T traumas. They don't want to relive it. They don't want to talk about it. They don't want to tell the story over and over again. They're tired of it. I had patients who would have a therapist who was retiring or was moving and or closing their practice, and it was going to be this huge event in their lives, primarily because they could not bear the thought of having to start over. And you don't ever have that with MAP. You not only don't ever have to start over, because if you've done the work's done. And not to say that there may not be more to do, but that it's done. The thing that you did, you at least this part of your subconscious has been dealt with, has been treated. But in addition, you don't have to dread starting over, because the starting over just, involves addressing whatever new symptom or thing it is you want to focus on. And you can do that in a timely fashion and an efficient way. Of course, as we talked about my draw to this therapy.
Yeah.
So yeah, that's awesome.
Yeah.
Really
So it
incredible.
does make it very easy to address things because, as you said, it often, especially when we're talking about trauma memories, it's often one and done.
Yes. Yeah.
Yeah.
Which is amazing. Just incredible. With children and MAP, so just for people listening, you treated my twins, my nine, they're now 9. And at the time, I think that was 2 years ago, maybe 3. So 6 or 7. And we specifically were bringing them in for management of the symptoms they were having after our house fire. Our house had caught fire on Christmas, and the twins had found the fire. And inadvertently, the fire department, when they arrived, the firemen and the policemen had said things to the twins like, you saved your family, and you're a hero and good job. And all of a sudden, my babies were carrying around the burden of like keeping their family safe. And then we were also utilizing MAP to help with the death of a pet. One of our dogs had died really suddenly and unexpectedly, and he was young. He was only like 4.5, and that had really done a number on them, in addition to the other things that had been going on at the time. So in treating children, I mean, I felt very, very comfortable, and I felt excited even. And Chad and I, my partner and I, sat there with the child, the individual child, having the session. But I always wonder, what's it like managing kids, because sometimes with kids, they have a harder time finding words, right? They have a harder time explaining what they're feeling, or for instance, ranking their feeling on a scale. Like that can just be, just outside their ability to kind of comprehend or communicate. So on the one hand, I wondered, is it more difficult? Are there more barriers to treating children because they have a harder time communicating? Or is just the fact that their neuroplasticity must just be through the roof, right? Like they're just so much more open than an adult brain is. Does that make it easier? Is it faster? Do you find yourself like, oh, we don't need an hour and a half, like this is solved? What's your experience, or does it depend on the trauma? Like what's that experience like with children?
Yeah. It can be all over the map. I
Mm-hmm.
feel
Mm-hmm.
like I used to say, oh, children, they rewire so fast, because
Yeah.
they are younger, because they are more open, because their store of memories is
Yeah.
smaller.
Yeah.
But I have had some cases where that has not been true. So I do think, just like with adults, right? There's quite a variety of experiences, and yeah, working with children is, yeah, it's a little different. It depends also on the ages, so I do work with a lot of teenagers, to young adults. um,
Mm-hmm.
and I work with them pretty much the same way I work with adults, say 13, 14 and older. They are pretty communicative, like we
Yeah.
work together pretty well. But I always think it is helpful for a parent to have had a MAP session first,
Yeah.
because we want at least one parent to have the full experience of at least one hour session, right? So that they have the sense of the flow of a session, what goes on in a session, so that they can determine for themselves, like, yes, I do want little Johnny to go through this. It's a more informed decision, I
Yeah.
think, when the parent has had the experience first. Some of my colleagues that work with parents and children who focus on this,
Yeah.
some of them require that the parent have a session first before enrolling their child. For the adolescents and young adults, I work with them pretty much the same way I work with adults. Maybe a little simpler language, simpler concepts, but
pretty much we run the session
Similar
the same way.
approach. Okay.
When they're younger than 12, sometimes they will be more comfortable if their parent is in the room. Then for young children, so your children were kind of on the cusp, right? 6 years old to 12 years old, it is often helpful for a parent to be present. Sometimes I do it as a group session. Sometimes, it is just the session's focused on the child. The parent is there for support. When parents come to me for sessions for very small children, then often what I suggest is that we do the session on the parent for the benefit of the child. So we use the parent as a proxy for the child.
Interesting.
The child doesn't need to be there. So 5 and younger, I would say, that is an option. Yeah.
Wow. That's really neat.
Yeah.
Yeah, because I can't fathom, like you, as you know, I have a 3-year-old also, who's lived through many of the same things that the twins have, and there's just that. I think the thing that we as parents tell ourselves is that you think they don't understand, right? There's like, oh, you can write it off. They're not old enough to understand the pain that everyone else is going through, which now I don't believe. I think that baby is very much aware of what these first years of his life have been like. And yeah, always wondered, because it's, as you learn more about MAP, there becomes a motivation to, right? This is one of the things you and I worked on for me, that idea of wanting to protect them early. Like, how do I help them along the way? Do I have to wait until they're adults and the trauma is really bothering them? Or can we be proactive and, help the child process these sooner? And again, especially for, I would say for my 3-year-old, what he's gone through in the last 3 years, those are some of the, bigger traumas that a little kid can experience. There are worse, obviously, but as far as the things the effect that it can have on a baby's psyche. So yeah, that's really interesting that the parents can be utilized as a proxy. How cool.
Yeah.
How has this method, how has it influenced your relationship with Western medicine, with the kind of traditional approaches to, in this country, at least, the traditional approaches to management of health or management of illness? Has it played a role in your life in that way?
Well, I think I probably already, kind of stepped away from the strict Western medicine approaches,
Yeah.
And before I was trained as a MAP method practitioner, and that was just based on my own, I don't know, inner compass,
Yeah.
just telling me like, nope, that's not for you. I mean, I can remember having all kinds of, just as one example, intestinal issues. And my husband, who's a gastroenterologist, is like, it sounds like you have IBS. You better come in and have a workup done. And I thought, no, I won't be doing that. It was just like, I don't know why, but I just sort of knew that, no, I don't think that's going to help me. I think I have to get my answers somewhere else. I mean, I wasn't, I wasn't demeaning, his profession. I wasn't against it. I mean, there was no animosity or anything. It was just a kind of an inner voice saying, no, you're going to have to figure this out your own way. And I did,
Yeah. Has it, so I have noticed, for me, a shift or a more questioning of Western medicine in general. I mean, obviously you and I kind of touched on that already in our last discussion. But I'm wondering, moving forward, on how it will influence my personal decision to move forward with screening techniques. So we have these, traditional screening, as for instance, your husband, the colonoscopy that's recommended at a certain age and with these very specific guidelines, and that you do this regardless. The same is true of mammograms. The same is true of pap smears. And interestingly, in Western medicine, those are presented to us kind of with an idea of optimal benefit and minimal pitfalls. And the truth is that's not true. I mean, a colonoscopy, don't get me wrong, has a role and is an incredible opportunity for many people. But to imply somehow that an anesthesia event isn't a big deal, to imply that going through even a bowel prep for many people is incredibly difficult and hard on the body. The risks that come with things like perforation and bleeding and complications after biopsy, I mean, all of that, let alone the potential for finding things that don't really need to be found, right? These idiopathic or kind of unexpected findings that then what do you do with the information? And that for a lot of people it leads to these unnecessary workups. And the same is true with mammography. So mammography is radiation exposure. To act like that doesn't matter is, it's the frustrating way. It's a misrepresentation of what radiation exposure does to our cells. It's also difficult because breast cancer is still an incredibly, common occurrence in women. It's still diagnosed in 1 in 8 women. I mean, that's numbers are far too high. And yet mammography is the only thing covered by insurance for screening, when we know for a fact that MRI and ultrasound combined is actually significantly more sensitive at detecting early breast cancer, at finding a breast cancer in a dense tissue. So if you are a younger patient with higher risk and you are having screening done, earlier in your life, they don't even pursue mammogram because the mammogram isn't effective. An MRI and an ultrasound of the breast is statistically better. We know this, and yet that's not what's offered to us. So we know there's a better way, and yet you're told you're going to take the inexpensive route that exposes you to radiation instead of the more effective route that is more expensive. So because there are these pitfalls in the way we screen, and these pitfalls in the results that come to us from those screening events, it has led me to kind of question how I'm just now approaching an age where these recommendations are going to start coming into play in my life. And I'm legitimately wondering what I'm going to do with the information, because the insight I've gained from MAP, just about trusting self and, about empowering self and about what the body's capable of with healing. It makes me wonder how I will utilize something that if I intuitively feel or I get the sense, hey, this isn't right for my body, the risk doesn't outweigh the benefit. And yet I'm a primary care physician. And so, my approach was always very much, we need to do your screening. Like these screenings need to happen. Do you, knowing what you know and going through your journey, and especially having access to these kind of energetic techniques, so things like, even things like Reiki or muscle testing and muscle checking, knowing that those aren't finite answers to things, and yet they do give you this intuitive glimpse into your body's health. Do you rely on any of that information or those teachings to help you make decisions about whether you will participate in screening personally, or does it not play a role? Are they kind of two separate entities for you? Or have you ever even thought about it?
I mean, I think you kind of take the best from each style of practice.
Yeah.
You do the thing that makes sense for you. I have already had a breast cancer scare,
Yeah.
I had my first mammogram and they found something, and I had to have the needle biopsy and the surgical biopsy, and then I got my own oncologist, and I got 5 years of tamoxifen, and I got scans every 6 months, and the whole
the whole regimen. Yeah, there's a protocol.
Do I continue to have regular mammograms? I do.
Yeah,
I do.
Yeah,
I just think it's probably good maintenance. Might I drop to every other year at this point? Yeah, maybe I will. But I don't feel like it's kind of set in stone. Like I'll only accept this and I'll never accept that. I just feel like you just take it as it comes, and in each juncture you kind of decide what is the best that I can utilize for myself, and maybe a combination of things, is what feels the best to you.
Yeah, that makes sense. It is. I think it's interesting to be able to kind of keep each of these things in their own lane, right? Western medicine is good at specific things, and MAP is good at specific things. But again, you have such an interesting background in your education and the way you ended up where you did, because your path, your journey, involved so many different, modalities that were being combined. But it's interesting to see kind of where that all overlaps in your own health. But I can also I can completely appreciate that it is such a personal experience for each individual patient that just kind of I wonder if participating in MAP helps people check into that in a better way, right? It helps people check into what it is they're truly comfortable with in a more empowering way. Because I think that's the thing that kind of happens in Western medicine is none of that is supported, right? Everybody gets treated the same. You're all everybody, the recommendation is you do the colonoscopy according to the guidelines, you do the mammograms according to the guidelines, the pap smears, et cetera, whatever it is. So as the guidelines change, you're just expected to change with it and increase or decrease accordingly. But I think that's also one of Western medicine's pitfalls, right? Is that there is no one therapy that's one size fits all. It has to be personalized. So it seems interesting. I think that exploring MAP therapy has allowed me to gain more insight into, or even just start the process of questioning, like, what am I truly comfortable with, and what am I going to allow as I move forward? What makes sense for my body. But it's interesting that even someone with your journey, I've known people who have predominantly pursued, these quote alternative medicines, most of them again existing long before Western medicine, but considered alternative, and they come out at an extreme, right, where they're not even willing to consider what Western medicine recommends, and somehow they would end up in my office, which was always, very strange. It was like, well, why incorporate me at all if everything I say is going to be greeted with a no, I'm not doing that. But I think again it was the nature of the way insurance works and financial issues, and so they'd end up at my door hoping I could help them get where they needed to get. And usually you can kind of find a compromise. But I think that's really interesting that even with your background being so extensive in these other modalities, that the way you come out is a very balanced approach to how to utilize each for what they're good at. I think that's a good lesson for people.
I think, we're having a background in MAP is helpful, is that by being able to manage our emotional and mental state as practitioners more constantly, able to be in a state that's more conducive to optimal health. Right, by staying out of that sympathetic dominant state, which is like it's so rampant now in our culture, in our country, and being able to be more in that parasympathetic state, I do think we set ourselves up for having more optimal health, right? And nothing is perfect, but
it certainly supports immune system function, and it decreases just at the basis you're supporting your immune system and decreasing inflammation, and we know that a functioning immune system and less inflammation is a positive thing for the body. So that makes good sense.
Even just those two positive effects. But and I think that for MAP practitioners and people that engage with the MAP process, working through the traumas. So this is kind of what we talked about in the very first episode that we did around your own story, right? Being able to use MAP to work through some of the traumatic experiences associated with medical care and interactions with the healthcare system, right, can be very helpful for people who decide to engage with, say, a course of chemotherapy or other kinds of surgery, other kinds of therapies and modalities. And, and even having come to the whole diagnostic process, which can be harrowing for people and a lot of fear, very fear inspiring. Being able to use MAP sessions like along that path does help to minimize a lot of the emotional turmoil, mental turmoil that can kind of overlay, what is already a difficult experience, right?
Yeah.
Being, dealing with your symptoms or dealing with your fatigue. I mean, this is already difficult enough, but then so often we're also carrying a lot of fear, a lot of emotional stress, a lot of other kinds of tension and pressures that just make the experience that much harder.
Yeah, it's kind of the foundation that you're building all your decision making on. So if that foundation is just a constant tornado of fear and emotion and things that haven't been sorted or neutralized, absolutely makes it much more difficult to participate in your own health in a functional way and to come from a place of empowerment. Whereas, I would imagine as a MAP practitioner, especially, but let alone anybody who's participating in MAP, you get to then make those choices, like even just participating in a screening process, right? Even that, I'm sure you can come from a place of calm and empowerment because the foundation is calm, empowered choice instead of, oh God, what's gonna happen? What is it gonna show? What if it has this, that's just a much clearer place to come from. So yeah, that's interesting. It's amazing. It's such a just such a neat process that I just really, really appreciate you going through this with me. I think for me, it makes it even easier and like more exciting to move forward with, additional MAP sessions for me. Just being able to understand kind of where you're coming from and how you got there and how you utilize this in your own life. It makes it all the more fun to move forward. It's like that's something to look forward to and continue to incorporate.
Yeah. Well, thank you for taking the time to pose your questions. And I feel like you're asking all the questions that people would like to know the answers to, but don't want to have to ask the questions themselves. And so it's nice of you to appoint yourself, the question master and to sort of, bring them in and we can have a chat about it. So I hope we get to do this again sometime.
Yeah, I anticipate as we go forward, more questions will build as I learn more about this process. And I've been in the role of asking the questions no one wants to ask for a long time. I think I put myself there as a child. And I've definitely challenged that theory of there are no stupid questions. I will ask questions into the ground just to gain more knowledge on a topic. So yeah. And again, for anybody kind of on the fence or deciding how to utilize MAP for themselves, that's the other really amazing thing I think that you bring to the table. I don't know if this is common of all MAP practitioners because you're the only practitioner I've had any experience with, but you just your what you provide your service is just bathed in resources too. So I think for some people, they don't care about the resources, right? They just want to show up and get the treatment and move on, and that's totally appropriate. That's a very, very reasonable way to utilize MAP because it's such a safe process. But I think for people who are coming from a background like me, where they do have a lot of burning questions and they, don't understand, right? They don't understand how this works or why it works. You are excellent at providing people with resource after resource after resource that can be utilized to, support and act as an adjuvant to the therapy itself. I really appreciate that about you.
I guess I see my clients as being on a journey to understand themselves, understand their purpose, understand their, what they believe in life. And I feel like, it is a privilege to help them to work with their mind.
Yeah.
As part of their goal of achieving, greater emotional, mental, or physical health. So I do try to offer as many resources as possible for people to pursue on their own if they are interested. I'll offer up different books or different videos or different exercises, techniques, for people to try alongside these occasional MAP sessions, because I do think that the investment that we make in learning at that time that we're pursuing something like a set of MAP sessions, is invaluable. So, I like to support that.
That's amazing. And it is just one more thing that helps the patient feel empowered. So yeah, thank you. I obviously will be returning as a patient. And, I'll let you know when the questions build up again to the point that I need 3 hours to discuss them with you.
Oh, I imagine within 6 months you'll have a nice list again. Thanks
you
for joining me.
Yeah.
Good talking with you.
You too.
Thanks for joining us for the Flourish with Neural Retraining podcast. Please listen again and remember to follow us and leave a review on iTunes, Spotify, Amazon Music, Google Play, or Stitcher. Check out our free courses about the MAP method, how it works, and how we use it for mind-body healing at map4health.us, or schedule your introductory session at mindremap4health.com. Until the next time, be well and flourish. Content of this podcast, copyright 2023 by Twin Cities Neural Retraining. Music by Barbara Ben.